Hi there. It is May of 2022, and I'm doing a COVID treatment update because it's been a while since we posted one of these, and things have shifted. We are still following and part of the FLCCC, and you can find protocols there for COVID-19 for prevention, early treatment, as well as long COVID treatment. The website is flccc.net or covid19criticalcare.com. So I'm just going to summarize what we've seen be effective in our clinic. We've now treated hundreds of patients acutely for COVID. A couple people needed oxygen outpatient, but no one has been hospitalized and no one has died of COVID in our clinic in the last 2 years. So what we are doing, number one, is you need to know your vitamin D status. If your vitamin D is low, and by low I mean below 50, and this is 25-OH hydroxy in the blood testing, then high-dose vitamin D is needed. Keep in mind that vitamin D, when you take high doses, it depletes vitamin A. So we often have to replace vitamin A as well. Both of those are fat soluble. So you can overdose on vitamin D and vitamin A. So it's not safe to do this on your own without knowing your blood level first. In general, we are using 20,000 to 50,000 IUs of vitamin D on the first day. In our patients where their vitamin D is very low, we're actually doing an IM injection of vitamin D instead of just doing oral. If you're taking oral vitamin D, it must be taken with a meal. You need to release bile in order to absorb the fat-soluble vitamins. So it must be taken with a meal, or you must be making enough bile. If you don't have a gallbladder, then you definitely need digestive bitters or some sort of ox bile to absorb your vitamin D. Okay, so that's the first thing. And then we taper the dose of vitamin D down depending on symptoms. And if this is prophylaxis, we often just give that big mega dose and then we wait and see if the person catches COVID. We're also using quercetin. We're using 250 to 500 to, in some people, up to 1,000 milligrams of quercetin a day with food. This allows the zinc to enter the cell. And we know that zinc is an antiviral. It's going to stop the replication of COVID. Even just if you have an exposure, the amount of viral particles you're exposed to makes a big difference, and getting the zinc into the cell will stop the replication of the virus. For zinc, we are using zinc picolinate exclusively, and we're using doses between 50 milligrams to 200 milligrams with a meal, because it can be hard on your stomach, at the same time that we give the quercetin. And again, this is more of a bolus where we give a loading dose, especially if our patients are low in zinc. We are checking a plasma zinc level every 2 to 3 months to know which of our patients are low. And zinc will deplete copper. So you need to know your copper status as well with a blood test. Or if you're using this as prophylaxis because you were exposed, you just take a one-time dose and you don't repeat because it will deplete copper. Melatonin, we are using anywhere between 5 milligrams and 20 milligrams for COVID prevention as well as treatment, because melatonin does have anti-COVID properties. We now have quite a few studies. You have to be careful with melatonin because it does suppress your cortisol. So timing-wise, you need to take it at bedtime, and you don't want to take this long-term. This is just something to be taken for 10 to 14 days. During COVID. Keep in mind that that beginning phase of COVID, the first 5 to 6 days, is the viral phase. After that, we are dealing with inflammation coming from the immune system overreacting from the virus. Very prevalent in our autoimmune patients that the immune system overreacts. Day 8 is usually the telltale day. If someone feels really well on day 8, especially if they're taking vitamin D and zinc and quercetin, great. However, a lot of people had started to feel better day 5, 6, 7, and then they feel much worse on day 8, and that's concerning. This is where we also use Nigella sativa, which is black cumin seed oil. This is a weight-based calculation, or you can get the life extension capsules as a direct antiviral, or we are using ivermectin. 400 micrograms per kilogram is the max dose of ivermectin. So we're not using any sort of veterinary or horse ivermectin, way too potent, but we are compounding this for patients in appropriate weight-based doses. The ivermectin is usually just once a day. You can take ivermectin twice a week as prophylaxis. You can also take black cumin seed oil twice a week as prophylaxis if you were exposed to COVID or if you're just out in the community at this time when we're seeing cases rise. The other thing I wanted to mention is lemon balm and peppermint. Both of these are wonderful antivirals. You have to take them 4 times a day. As many herbs go, they do not last in your system too long. It's really important to get proper sleep and also wash out the areas that have been exposed to COVID. So we've been saying this all along, but if you know you were exposed, then biocidin, which is a wonderful herbal blend, placing that in the neti pot, washing out the nose, as well as gargling with the biocidin essential oils in some salt water is wonderful. People are also using iodine or biocidin in a nebulizer to actually prophylaxis after being exposed to COVID. So dosing wise, it is very individualized, which is why it's great to call if you're exposed or call if you have symptoms. And in addition, a lot of these agents, you need to know your baseline going in. So get your vitamin D tested, get your zinc tested, but let us know if you are exposed and let us know if you need acute treatment. Hope that helps.